Hello, my name is Dr. Shane Watt. I'm the treating chiropractic physician at Neurobolic Health Center. My office is located in South Jordan, Utah. Today I'm going to discuss just for a brief few minutes of letting you know that there's hope for those who are suffering with peripheral neuropathy. I know firsthand from experiences that's happening with my own dad that a lot of people don't think there's any hope. They've been told for years nothing can be done. My dad just recently, because he had progressed so far, just recently had half his foot cut off. I don't want to see that happen. I've learned protocols. I've invested in equipment. I've done everything I can to try to ensure that no one else will have to suffer like my dad has. Have you been told that there's nothing that can be done? Have your doctors told you there's nothing they can do other than give you medications? And those medications are not necessarily for peripheral neuropathy anyway. They're usually antidepressant or anti-seizure medications that have side effects, that only have symptomatic relief but never help the problem. Do you wish that your doctor would find answers for you? And most important, are your symptoms continuing to get worse? Because I would say 99.9% of patients, they don't get better on their own. They just don't. Peripheral neuropathy continues to get worse and worse and worse. I have a patient that just started our program a few weeks ago, very short time. He's already having drastic changes with his peripheral neuropathy. He's been told all this. He's been given all this. And in our program, he's already seen great changes. So I'm going to let you watch this short video of him, and then I'll be back in just a few moments. This is Ted. He just started our peripheral neuropathy therapy about 3 weeks ago, and he's already having some really good success. Now, I just wanted to explain a couple of things. When we first started with him, he had almost no feeling in his big toe. He couldn't even feel ice. And the other day we put some ice on him and he was able to feel it. But he's having some other really good changes. So Ted, just go ahead and kind of explain some of the things that you've seen so far and just changes in just a short 3 weeks.
Okay, I was very fortunate that my wife found Dr. Watt on the internet and suggested that I come here. I have seen a lot of different doctors. My general practitioner has sent me to podiatrists, to neurologists, to surgeon, to I'm trying to think of what the other one was, rheumatologist, all of which gave me no hope, offered anything. They put me on medicines for pain, but did nothing at all to control the neuropathy. In fact, I have even heard from doctors that there's nothing you can do to help the nerves once they go bad. So that's not been the case here. I'm actually able to sleep much better at night. Not only have I had a reduction in pain, but I have a dramatic reduction in pain occurrences. They're much less frequent. And the home unit that Dr. Watt has me using, I can take that and just feel like a young kid again many times after I'm done using that. And the sessions that I do here are refreshing, and I'm making progress, and it's critical. I think a lot of us, we think we can live with the pain, but as it gets worse and worse, the worse it gets, the harder it is. I just barely was accepted by Dr. Watt because he didn't care for my results at all. So there you go.
All right. And he's had, like I said, he's had some great changes. He's already noticing changes in his balance. He actually tried jogging the other day and was able to do that, which he hasn't done for a long time. His sensation in his feet has drastically improved. And one of the things, when he first came in, he was constantly moving, twitching, rubbing his legs and all that kind of stuff. And you said the other day you were actually able to sit through a meeting for several hours and everyone noticed that you weren't rubbing your legs all the time trying to stimulate sensation, right? Exactly. So that's cool. So this is just part of the things, and he's just barely started. So Ted's done awesome. He's doing well on the diet. He's doing well on making these appointments to do good. But that's what the biggest change is, what we do here for people, is because people are given no hope, and this gives people a chance that there is hope and there are answers. So thanks very much, Ted. Appreciate it.
Right. Thank you. And I do think you do. When Dr. Watt tells you should be doing something, you need to be for doing it.
Yep, thank you. Yeah, that is true. You want to get better. That is true. All right.
All
I would like to thank Ted for taking a few minutes out of his time and his schedule at my office to share his thoughts on what we've been able to do for him. He's had remarkable changes. When he first came in, there were certain tests we did. He could not feel hardly anything in his big toe. He couldn't even feel ice on his toe. 3 weeks later, he now can feel it. That's a major change. He told you all the things that were happening with him. That's incredible. And we're able to make those changes with all of our patients. You're watching this because we're advertising that we're doing either an evaluation or a seminar. At the seminar, which I encourage you to come to, it is well worth the hour of your time. Please come. Please call, make an appointment, and come on in. The things that we're going to be discussing is in peripheral neuropathy. What exactly is peripheral neuropathy? What causes it? What can be done to restore peripheral nerves to health? You've probably been told that you cannot change those nerves, that you cannot restore those to health. That is not true. They can be helped. Now, with the caveat of that, if it's progressed too far, we're done. We can't. And I'll tell you whether I can help you or not. On our evaluation, if you don't score over an 85%, if you score less than 85% function, I can't accept you as a patient. I won't be able to help you. They're too far gone. Don't get to that point. We discuss how metabolism is vital and critical to your restoring health. The leading causes of peripheral neuropathy. What does the neuron need to revive and repair? And once again, yes, they can. Well, they need fuel, activation. They have to have decreased inflammation. You cannot get a healthy nerve to change or to increase that health with inflammation. You've got to decrease internal inflammation. One of the major things we do is I'm the only one in Utah and some of the actually surrounding states that have the most modern equipment to help with peripheral neuropathy. It's called horizontal therapy. Please watch my full-length video on peripheral neuropathy made easy. That will give you a lot more information on what we're doing. I encourage you strongly to go from here to watch that video. Once again, it's called Peripheral Neuropathy Made Easy. And that's about 30 minutes, but we'll go through all the different things that we do because there's so much that can be done and that we do to help you in our office. Once again, my name is Dr. Shane Watt. I'm at the Neurobolic Health Center. We're located in South Jordan, Utah. Please, please, please call my office, 801-495-4444, and schedule to either come in for the seminar or come in for a peripheral neuropathy severity evaluation. We will let you know whether we can help you because there are some patients that we can't. Don't get to that point. Don't get to the point like my dad where he's had to have part of his foot cut off. Please give us a call so that we can help you. Call my office, 801-495-4444. Thank you so much for watching this. Once again, please watch the Peripheral Neuropathy Made Easy, the longer version that will give you more answers to what we do. Thank you for your time. Don't hesitate, please call.